So in today's Pharma Harma, we're talking about medicines that deplete vitamin B1, aka thiamine. Now, why is that important to understand? Thiamine deficiency has been linked to multitudes of different types of diseases, including dementia or Alzheimer's, as well as neuropathy, congestive heart failure, high blood pressure, and muscle pain and neuralgias, and so many other types of symptoms. So many people suffer with these problems on a regular basis, and understanding which drugs cause thiamine deficiency will help you avoid the polypharmacy trap. So let's look at the screen above here. Let's check out this paper that was recently published, and I want to make this very, very clear. Many doctors will tell you that thiamine deficiency or vitamin B1 deficiency only happens in third world countries where children are starving to death, right? And so this is a quote directly from this study. You can see here, mild to moderate thiamine deficiency symptoms are frequently overlooked or misdiagnosed. Furthermore, even in conditions known to predispose patients to thiamine deficiency, the variability in the presentation of the disorder suggests that unknown confounding factors may also contribute to the syndrome. Unfortunately, recent studies echo the complexity of recognizing thiamine deficiency and suggest that thiamine deficiency, even in developed countries, key phrase, even in developed countries, that means us, USA, Britain, New Zealand, Australia, etc., European Union, is underdiagnosed and undertreated. Again, let me repeat that. Studies echo the complexity of recognizing thiamine deficiency and suggest that thiamine deficiency, even in developed countries, is underdiagnosed and undertreated. Unrecognized thiamine deficiency is a real problem, as the neurologic sequelae may increase the burden on healthcare systems and reduce the general health of world population. So that's a pretty big statement. So now we want to understand, if that's true, what drugs, what medications can actually contribute to thiamine deficiency that are commonly prescribed for common diseases that people are treated for. So if you look at this graph, you can see this is the same research study. Okay, this is a graph they put out, and this was an analysis done. It was a computer model analysis based on a number of factors, but these were all the medications that they came back where they suspected that, if given, would contribute to or cause thiamine deficiency. And you can see their conclusion is, our comprehensive analysis of prescription drugs suggests that several marketed drugs inhibit THTR2, that's the thiamine transporter, which may contribute to thiamine deficiency, especially in at-risk populations. Now, if we want to simplify it, let's move on to this. You can see these common classes of medications deplete thiamine. The first is diuretics and other blood pressure lowering medications. Then we have oral contraceptives. So ladies, those of you who are taking birth control pills, or maybe you're on some type or some form of estrogen postmenopausally. And then we have seizure medications. So those of you with a diagnosis of epilepsy or seizures, and then antibiotics. So that's any class of antibiotics that are known to really, really inhibit thiamine. And then the diabetic medication metformin. So these classes of medications, if you're taking them, what should you do? What's the takeaway here? So thiamine deficiency symptoms are common, right? And oftentimes the symptoms of thiamine deficiency are confused as diseases. So when you go to the doctor, instead of the doctor looking to see whether you have a thiamine deficiency, maybe they're giving you a diagnosis of a disease. For example, high blood pressure, and now you're on a blood pressure medication, and the blood pressure medication you're taking is reducing your thiamine, but you already have high blood pressure because you had a thiamine deficiency, and so now the medication just exacerbates the deficiency and accelerates it, and then you end up with another set of symptoms or another disease that is also thiamine related, and then you end up on another medication, right? So it's kind of the pattern. So if you look again, here are some of the common conditions that we know thiamine deficiency can cause or contribute to: high blood pressure, congestive heart failure, anxiety, depression, muscle pain, dementia, neuropathy, to name a few. Again, these diseases and symptoms are commonly treated by medications that can further deteriorate your thiamine stores. All of this could be prevented with simple testing and monitoring. So ask your doctor if your medicines cause vitamin B1 deficiency. That's one of the best things that you can do. So again, the takeaway is ask your doctor if thiamine or vitamin B1 testing is right for you. Don't forget to ask that question and demand better care.